You're listening to an African Elements top news story for June 26, 2025. Please visit our website at africanelements.org for more daily news. The United States is witnessing a significant shift in its approach to public health, particularly concerning vaccinations. Health Secretary Robert F. Kennedy Jr. has initiated major changes impacting both international vaccine funding and domestic advisory panels. These actions have sparked considerable debate among global health experts and public health advocates, raising questions about the future of vaccine policy and its potential effects on communities, especially those in the African diaspora who often rely on global health initiatives. For generations, our communities have understood the importance of collective health and protecting the most vulnerable among us. Therefore, these recent developments demand our close attention. The decisions made today will shape health outcomes for years to come, influencing how diseases are prevented and managed across the globe and right here at home. Health Secretary Robert F. Kennedy Jr. has made a pivotal decision to withdraw U.S. funding for Gavi, the Vaccine Alliance. This move marks a significant departure from previous U.S. commitments to global health initiatives. Kennedy announced the U.S. would stop funding Gavi, a global vaccine group, citing vaccine safety issues. He made these remarks at a Gavi pledging summit in Brussels, where he praised Gavi's mission but then criticized the group for ignoring the science on vaccine safety. Kennedy stated the U.S. would not reconsider its decision until Gavi re-earns the public trust. A video statement from Kennedy, shown at the Gavi fundraising event, accused Gavi of making questionable recommendations regarding COVID-19 vaccines. He also raised concerns about the DTPW vaccine. The DTPW vaccine is a combination vaccine that protects against diphtheria, tetanus, and whooping cough using a whole cell component. This differs from acellular pertussis vaccines, which use purified components of the bacteria. Gavi, established in 2000, states it has played a role in vaccinating 1.1 billion children against various diseases and claims credit for saving 20 million lives. Global health experts consider Gavi instrumental in providing vaccinations to lower-resource countries. Gavi responded to Kennedy's concerns by stating that safety is key and it acts in line with World Health Organization recommendations. Gavi expressed full confidence in the DTPW vaccine, noting its contribution to halving child mortality in supported countries since 2000. The Trump administration had previously indicated plans to cut its annual funding for Gavi, which was approximately $300 million. The U.S. withdrawal of funding from Gavi, a vaccine donation program for low-income countries, suggests potential negative impacts on global health outcomes. The establishment of the Vaccine Integrity Project, an advocacy organization created to help safeguard vaccine access and coverage, further indicates concerns about potential disruptions to vaccine programs. These disruptions could be exacerbated by funding cuts, potentially affecting millions of children in vulnerable nations, many of which are in Africa. The impact on these communities, which often face significant health disparities, could be profound, undermining years of progress in combating preventable diseases. Health Secretary Robert F. Kennedy Jr. has also dramatically reshaped the Centers for Disease Control's Vaccination Advisory Panel. He abruptly fired its previous members and appointed vaccine skeptics to the panel. Kennedy announced 8 new members for the CDC's Vaccination Advisory Panel following the firing of its 17 sitting members. Several of the newly appointed advisors have gained prominence for their vaccine skepticism, including against mRNA technology used in COVID-19 vaccines. The American Medical Association raised concerns that the new panel was selected without transparency and proper vetting. The new CDC advisors are expected to study the childhood vaccination schedule and guidelines for hepatitis B and measles shots. This comes at a time when measles vaccination rates in the U.S. have been declining, with over 1,200 cases reported this year. This is among the most since the disease was declared eliminated in the U.S. in 2000. 2 school-age children have died in a West Texas measles outbreak, and 1 adult died in New Mexico. All were unvaccinated. The new CDC Vaccination Advisory Panel, under Kennedy's influence, plans to review the immunization schedule. Experts are concerned this will lead to changes that undermine public health. Kennedy's vaccine panel is set to break norms and plans to review the immunization schedule. The new ACIP panel will review the childhood immunization schedule. Experts warn that Kennedy is unraveling the system that kept vaccines safe and that he arbitrarily, unilaterally, without evidence, science, research, or fact, decides to change a vaccine schedule. The CDC's recent change to COVID vaccine recommendations for children to shared clinical decision-making has already caused confusion among parents and pediatricians. Further changes to the schedule could exacerbate this, potentially leading to lower vaccination rates and increased outbreaks of preventable diseases. This would disproportionately affect communities with limited access to healthcare and information. The provided information does not detail specific scientific studies or data cited by Kennedy to support his claims about vaccine safety issues. However, it does indicate that Kennedy has a history of making unsubstantiated claims regarding vaccine safety. Kennedy has previously falsely claimed that Bill Gates is committing genocide by funding the delivery of vaccines to Africa that Kennedy said were horrendously lethal. There is no evidence for this claim. Kennedy has long decried hepatitis B vaccines, linking the shots to autism, allergies, and SIDS, despite government agencies and public health experts stating the vaccine is safe and effective. Experts express concern that Kennedy's actions are unraveling the system that kept vaccines safe. They also worry that he is changing vaccine schedules arbitrarily, unilaterally, without evidence, science, research, or fact. The establishment of a new advocacy organization, the Vaccine Integrity Project, underscores these concerns. This project aims to help safeguard vaccine access and coverage due to concerns about the scientific integrity of the remade ACIP panel. This suggests a perceived threat to established vaccine safety protocols. The scientific consensus, supported by decades of research and global health organizations like the World Health Organization, affirms the safety and efficacy of vaccines in preventing infectious diseases. This consensus is built upon rigorous testing, continuous monitoring, and transparent data analysis. For Black communities, who have historically faced medical mistrust due to past injustices, these developments are particularly troubling. Trust in public health institutions is fragile and hard-won. Actions that appear to undermine established scientific processes or promote unsubstantiated claims can further erode this trust. This makes it harder to protect our families from preventable illnesses. Maintaining clear, evidence-based communication about vaccine safety is crucial for ensuring that all communities, especially those that are often marginalized, have access to accurate information and effective health interventions. The decisions made by Health Secretary Robert F. Kennedy Jr. carry significant implications for both global health and the well-being of communities, particularly those in the African diaspora. The withdrawal of U.S. funding from Gavi could severely impact vaccination programs in low-income countries that rely heavily on this support. These programs are vital for preventing outbreaks of diseases that disproportionately affect vulnerable populations. A reduction in vaccine access could lead to a resurgence of preventable diseases, reversing years of progress in child mortality and public health. Domestically, the restructuring of the CDC's Vaccination Advisory Panel raises concerns about the integrity of public health recommendations. The appointment of vaccine skeptics to a key advisory body, coupled with plans to review the childhood immunization schedule, could lead to policies that are not fully grounded in established scientific evidence. This could further fuel vaccine hesitancy, contributing to declining vaccination rates and an increase in preventable disease outbreaks. For Black communities, who have often been at the forefront of health disparities, any weakening of public health infrastructure or erosion of trust in medical science could have severe consequences. This would make it harder to achieve health equity and protect our collective well-being. The potential for increased disease outbreaks and a decrease in vaccine confidence is a serious threat. It is essential for communities to remain informed and advocate for policies that prioritize evidence-based public health practices. The long-term effects of these policy shifts could be far-reaching, impacting generations and potentially widening existing health gaps. Copyright African Elements.